The Doc is In is sponsored by Amada Senior Care.
Happy to have Fox 56 News Chief Medical Contributor Dr. Ryan Stanton in once again for another segment this morning.
This morning, he's continuing to tell us more about Breast Cancer Awareness Month.
Yeah, this actually worked out very well. I mean, if you take all three of the segments, push them together, you have a nice 6-minute story on the breast cancer awareness. You know, our initial statistics we did about 30 minutes ago, Vasi's segment on getting into some of the screening programs and recommendations there, and we're going to continue on that and kind of lay out a little bit more of the rules there. So maybe you do that later today. Just wedge them all together, have a nice little segment, you get the whole story and get Breast Cancer Awareness Month. So
I like your idea.
I like it. Let's do it. So we've talked about the screening, and Vasi actually dove into it a little bit with the folks from Marquis Cancer Center with the age 40. That is the key. The recommended start to screening with mammograms is age 40. Current recommendation is continuing until age 74 with annual mammograms. Over age 55, there is the option based on your risk factors to potentially go to every 2-year screenings, but that's still a little bit up in the air, but that's definitely working with your doctor and whether there's been any abnormalities or any significant increased risk factors. Now that 40 to 74 is not a firm diagnosis in terms of timing. If you have risk factors such as family history or other contributors, things that increase your potential risk of breast cancer, even potential earlier cancer screenings may be recommended, or even the potential of other modalities on top of the traditional mammogram. Now the challenge is that fine balance between a mammogram versus other things versus over or false positive testing, meaning that something's seen that's not actually cancer that leads to further diagnoses that may be more invasive or things that may not be necessarily. So it's that fine balance of trying to reach where do we get these false positives versus where are we making sure we're catching as many cancers as possible at early stages. And so that's the key. The recommendation here is that 40 to 74, potentially earlier with risk factors, and working with your doctor based on your risk factors if you need other modalities of evaluation.
I think it's also important to point out that no matter what age you are, to do at-home breast exams on yourself.
Yeah, the self-breast exams, learning that early is key because that is one of the earliest detection methods is the self-exam, understanding your own body and being able to check and knowing that something is different, getting that checked out. I've seen a number of women over my years in medicine that actually have diagnosed their own cancer because of actually doing regular breast exams, which is very important.
Fantastic. Doc, thanks for coming in, sharing a lot of important information.
Appreciate it.
And of course, the pink looks good. Men can
I
wear
like it.
pink
Thank
too.
you.
We'll be right back with our final hour of the newscast.
You're watching Fox 56 News. Our home, your news.